Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP's cable television channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome to Your Health radio and television program. I'm David Morwood. I'm a board-certified plastic surgeon, and my very special guest today is Dr. David Goldberg, plastic surgeon and chief of the Department of Surgery at Community Hospital. Dr. Goldberg, thanks very much for joining us.
Thanks for having me on, David.
Dr. Goldberg, let's review for perhaps if we have some young people listening. How does one get to be a plastic surgeon?
Sure. Well, the process of becoming a plastic surgeon is a long process, so any young person considering it should plan for many hours of study and hard work. After high school, of course, there's college, and I spent 4 years as an undergraduate at Boston University, and then after that, 4 years of medical school.
So that's after high school, 4 years of college, and then 4 years of medical school.
4 years of medical school, and then internship and residency. And it's usually the last year of medical school that one decides what subspecialty they want to go into. I chose to go into surgery. I wasn't sure that I wanted to be a plastic surgeon initially. I enrolled in a general surgery residency, which is a requirement for plastic surgery anyway. Spent 4 years there, and then enrolled in a plastic surgery residency afterwards.
Right. So let's explain what the difference between an intern and a resident is.
Sure.
What's that mean if you do an internship and then you do a residency?
And that is a confusing term, and I think in some regards antiquated. An internship really reflects the first year of your residency training. The term intern was often used in the 60s and 70s to describe an in-house physician, medical physician, and so the term got a little bit interchanged and confusing. Right. But for the most part, people need to understand that the internship really reflects the first year of your postgraduate, post-medical school training, and after that, we enter a residency. So I spent 6 years training as a general surgeon and then plastic surgeon, and then after that, I completed a fellowship in breast reconstruction. So it was 7 years of training after medical school, after high school. So add 4 and 7 up, and there you get the gray hair.
Right. So, so that's a lot of years of studying and training. So after high school, it's 4 years of college. Well, excuse me, 4 years of college, 4 years of medical school, internship, which is part of residency, and then plastic surgery residency, and then you did a fellowship.
Exactly.
So I know that breast reconstruction is one of your areas of interest. Isn't that right?
Absolutely.
And I know we have a breast care center here in Monterey, and you're very active in the breast reconstruction and the breast care conferences, et cetera.
I am. We have a very well-organized multidisciplinary system that involves all the areas of care for patients who have breast cancer or undergoing evaluation of the breast, including mammography, general surgery, oncology, plastic surgery, support, nursing, radiation oncology, excuse me.
So, Dr. Goldberg, how is it that a plastic surgeon gets to be part of the breast care conference or the breast care treatment team? How does the plastic surgeon fit into that?
Well, as it is a multidisciplinary committee or group, plastic surgeons participate in a number of aspects of the care of the breast cancer patient. We assist the general surgeon at times in planning and design of mastectomy scars and mastectomies, and then certainly we involve ourselves in the reconstruction of a patient's breast that often occurs at the same time that a mastectomy is done. And one of the great parts about breast reconstruction surgery is that breast reconstruction can be completed or at least initiated at the time of mastectomy.
Right.
Nice.
So, Dr. Goldberg, oftentimes people will say to me that they're confused a little bit why we're called plastic and reconstructive surgeons. It sounds like most people think of plastic surgery as cosmetic surgery, but they're not all that aware of the reconstructive aspect of it. Isn't that true? Do you find that?
Well, I think people do get confused. Part is because of the internet and what people read in the nomenclature. Plastic is a Greek word that means to mold or to shape, and that's where the term originally came from. And we're certainly involved as plastic surgeons in remolding and reshaping people, particularly after injury. And that's where the term initially came from. Most plastic surgeons started out as reconstructive surgeons, and it has evolved over the years into a field that incorporates both reconstructive and cosmetic surgery. So, though people subspecialize in individual areas, and you may have a plastic surgeon that does only rhinoplasty surgery, the majority of surgeons do participate in multiple aspects of plastic surgery that incorporate both reconstructive and, let's not say, elective, not necessarily cosmetic.
Right. So I know, as I said, you are a plastic surgeon and you're the chief of Department of Surgery, and I know you take emergency room call and you're at the hospital and you do inpatient as well as outpatient surgery. Isn't that right?
That's true.
So let's talk about one of the areas of our field, plastic surgery. It seems like everybody wants to look better, of course, and most people think they perhaps might want to look younger. Let's say someone comes into your office and they say they want to look better. They want their face to look better, and they may say they want their face to look younger. Dr. Goldberg, what's your approach in counseling that patient about things they need to think about?
Okay. I think that patients all want to look, for the most part, younger. We want to look better. We want to feel young. And patients don't always know exactly what procedure would be right for them. Our role, certainly during the consultation, is to guide them, to provide them an understanding of the aging process, and then give them alternatives for potential procedures that could be done. We need to discuss the risks, the benefits, and the potential complications. And so there's a comprehensive process of evaluating a patient.
Okay, so traditionally we've spoken about plastic surgery, which means operations. Now I think everybody picks up the latest magazine or the newspaper and they can read about lasers or skincare or injectables. They can read about Botox or fillers. Can we start by how you counsel a person in your office about what we might call these non-invasive treatments?
Sure. Well, the first thing I do when a patient comes in the room is I try to get an understanding of what bothers them. I also try to get a good history of whether they've had procedures before, what type of sun exposure they have, their social history such as smoking. Stress can cause aging characteristics, and getting a general and a very good history on the patient gives us a good idea of what's going on. Then I instill some background information about my philosophy towards surgery, the goal of which is to help people look better, feel better, though I try to provide people with alternatives, and I break things up into what we call minimal, moderate, and more comprehensive procedures. Not everybody wants to come in the office and have a facelift. Some people are busy today. They work hard, and very few people have significant downtime. And it's our job to provide them with alternatives. So probably the first thing I do is I grab a mirror like this, and I tell them, stop holding it up to their face so close. We should judge ourselves by what I'll consider or call normal conversational distances. Put the mirror back a little bit. A mirror so close, particularly the 6x mirrors that are sold and all women use, show aging characteristics that are not noticed by the general public. So put the mirror back, step back, and then evaluate yourself. I think that's a better, more restful way. It hurts the confidence to look so closely. I judge the skin, and I think it's a good process of evaluating them from the outside to inside. And as you know, the aging characteristics involves skin and skin of the face, the tissues under the skin, which are called the subcutaneous tissues, and then the bony or skeletal structures. It gets complicated, but in essence, out to in is the process of evaluating for me and the patient, and then top to down. I start with their hairline, brows, and go down.
Do a lot of people come in and say to you, am I a candidate for Botox? Am I a candidate for fillers? I mean, it seems like in every magazine and newspaper now, I mean, it's all about Botox and injectables. I mean, first of all, can we explain what is Botox?
Right. Well, Botox is botulism toxin. It is derived in a laboratory from the production of the bacteria. The toxin itself is isolated, removed, and then packaged in a powder form, to which we dilute in the office. It's sterile, it's purified, and then we inject it. Now, we're not injecting the bacteria. We inject tiny little doses of the toxin itself, the goal of which is to temporarily inhibit muscle contractions. It works very well in some facial areas between the eyes and on the sides of the eyes where the squint lines occur to give people a more relaxed and comfortable view. It doesn't eliminate wrinkles, it reduces them, and it is temporary.
Okay, so I think that's a key take-home message, that Botox is one way we can give a person a more relaxed look around the eyes because it reduces fine lines and wrinkles. Would you say that's accurate?
I think that's absolutely accurate.
So is there somebody who's too young or too old for Botox? Like, who do you think is a good candidate for a Botox injection?
Well, I think the area that Botox specifically works best is between the eyes in the region right here, what we call the glabellar area, and I've noticed myself I'm developing a more defined wrinkle over time. The glabellar area is created in the deepening of the furrow by muscle actions of two muscle groups that are between the eyes. People often come in and say their friends say they're tired, or coworkers, or that they look angry. And the medicine itself works extremely well to reduce that look of intensity between the eyes. That's probably the primary area that it's effective. It's also effective in the forehead and on the sides, but in areas, who are the patients that are not great candidates for it? Medically, if a patient has a known allergy to Botox, which is extremely rare, that obviously would be a patient that's not a good candidate. In a patient that actually has a droopy eye on one side, you need to be cautious about placing the Botox. That droopy eye is generally caused because of a muscle weakness. So there are certain people who have medical conditions which make them not particularly good candidates, or would be considered contraindicated.
Okay,
That makes sense.
perfect. So Botox is one way that we can do non-surgical facial rejuvenation, or at
Absolutely.
least start on rejuvenation.
And Botox is popular for a couple reasons, but one primary reason. It works, and it's safe.
Okay.
And I don't own any stock in Botox company, but it is very popular because it's effective in virtually every single patient, and the risks are extremely low.
Okay.
And that's
Perfect. So that's Botox. Now let's go one step above if we can. Now what about facial fillers? I
Okay.
mean, there must be 10 of them on the market now. There's
Right.
Juvederm and Captique and Restylane. What's this facial filler business all
Right.
about?
Well, the basics to it is over the past 10 years, we have a better understanding of how the face ages. We understand that it's not just the skin drooping, but the face has volume to it, and it has, as I view it, anterior projection. The cheeks are full. A young child's face is full, and full with fat. And as we age, some of that fat declines. It declines in its position, and it declines in its volume. The view of using injectable fillers, whether they're an off-the-shelf filler like Restylane, Perlane, Juvederm, or utilizing your own fat, the concept of it is to fill the face back up with its volume. It works particularly well in the cheek area, it works in the lip, it works in the folds, which are the smile lines, and it's extremely effective.
Now you raise a very interesting point that I think a lot of our viewers and listeners may be interested in, and that's injection of their own fat. Now, how's that process work?
Well, the development of it came as an offshoot from the liposuction field, in that, and also in the grafting field. But for the most part, we know that if we remove fatty material, fat, carefully and selectively, and then re-inject it, those individual fat cells can actually live and survive. And the areas of replenishment within the face can be taken from the donor sites in the abdomen or hips. The benefits of utilizing your own fat is it's your natural material. Most people have a modest abundance of it, and it is long-lasting. The process of it is different than doing liposuction, though. In the traditional form where we view moving fat via liposuction, that's fat that we're kind of damaging and discarding. The process of taking fat grafts involves a very meticulous and careful process of suctioning individual morsels of fat cells in a sterile environment, being extremely careful with them, selecting out the best and purified area of fat, and then re-injecting it with tiny syringes in what we call microaliquots through specialized equipment.
Okay, so we've talked about two different ways that we can restore volume to the face or to fill up fine lines. One is by these so-called injectables that you can get off the shelf or off the counter, Juvederm, Captique, etc. Another way is with a patient's own fat, right?
Right.
Let's move on to a different area. Oftentimes, especially people living in California, they want treatment for their skin texture or little skin changes, or should I say pigment changes. What about skin care or laser or little peels in the office?
Well, my view is the most important thing a patient can do to maintain their health and beauty of their skin, or at least health and attractiveness of their skin, is to do medical skin care. The same social issues apply, such as not smoking, limit your outdoor exposure, minimize your sunburns. We know that skin cancers are virtually epidemic, and we need to be cautious about our sun exposure. So the process of utilizing skincare, I think, is extremely effective. And I know this anecdotally from my former partner, Dan Strickland, who practiced here for 25 years. The patients of his who would come into the office, who were older, 70, 75, 80, and would say to me, well, I'm never going to have any real plastic surgery, but I'll do skincare, participated in routine skincare. And they often looked great. They were careful about management of their skin, and it's very effective. The process, for the most part, involves utilizing glycolics, alpha hydroxy acids, or mechanical peeling to exfoliate the outer layers of the skin. By removing those outer layers, you can stimulate some of the lower layers to reformulate and regrow. We remove pre-pathologic skin lesions, and the process can be extremely helpful.
Okay, I think that's very helpful. So we talked briefly about Botox. That's a way to relax the muscles to minimize fine lines and wrinkles. We talked about facial fillers, whether we take them off the shelf, things like Captique or Juvederm, or we use a patient's own fat. And then there's those topical skin care treatments like mini peels or glycolics, as you mentioned. That's a way to try to reverse or minimize sun damage. What about the patient who may have redundant skin, say in their jowls or their neck? Then do we move to a point where the patient could consider actual plastic surgery?
Right. I think that's a great question. The most, I think, important thing in evaluating a patient is trying to get an understanding what is happening to them, how they're aging, and what they would actually consider to have done, if that makes sense. And so we need to be cautious about making recommendations for procedures that would not necessarily be helpful, such as non-invasive procedures, minimally invasive lasers that actually will not lift skin of the lower face and the neck. Probably one of the most important treatments that has been developed is an effective facelift through treating the redundant skin and muscle of the lower face. That's a comprehensive operation. It takes a few hours to do. It needs to be done in an appropriate setting. It involves real incisions and anesthesia, but it is a very effective measure to help turn back the clock, and probably the most effective measure.
Well, Dr. Goldberg, you practice here in Monterey off Highway 68, and I think you're in the phone book, or do you have a website?
MontereyPlasticSurgery.com is my current website, and we're just getting that underway at this point.
Excellent.
But I'm certainly in the phone book and always available in the hospital.
Excellent. Well, Dr. Goldberg, to kind of recap, we've talked about some minimally invasive or non-invasive treatments, and we've talked about some actual operations, plastic surgery. It sounds to me like there's lots of choices, and that's one of the reasons why we encourage patients to check on people's credentials and to go to someone who's trained.
Yeah, exactly. Patients have the right to ask questions. And they should feel comfortable asking their doctor questions about their credentials, their backgrounds. They should be comfortable asking for patient recommendations or patient referrals. When a patient meets a doctor, they should feel comfortable in the setting with the physician. Make sure that they ask appropriate questions. They can look at our national website for plastic surgery, which is www.plasticsurgery.org. They can find board-certified surgeons from that website. Ask questions and you'll get good answers.
Well, Dr. David Goldberg, you're a board-certified plastic surgeon, and you're chief of the division or department of surgery here at Community Hospital. And you practice here off Highway 68 in Monterey. You have a skincare center in the office, and you practice mainly at Community Hospital. I appreciate you coming by, and I feel like we barely scratched the surface. I wonder if you'd consider coming back again.
Absolutely. We can talk about any specific topic you want. It is difficult to discuss the breadth of surgery in the short period of time. But it's an exciting topic, and I think people are interested in learning.
Well, Dr. Goldberg, I know you're very experienced, and I appreciate you coming on the show.
Thanks for
very
having
much
me.
for talking.
Thanks for having me, David.
Once again, this is Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I hope you'll hang on. We're going to come right back after a very brief pause for a very good cause. And once again, my guest, Dr. David Goldberg, board-certified plastic surgeon and chief of the Department of Surgery at Community Hospital. Dr. Goldberg, thanks very much for being here.
Thanks for having me.
So